So we're trying to define the characteristics which is usually seen in Marfan syndrome. Okay, so this is Marfan's habitus. So Marfan's habitus, I think, is how somebody that has a Marfan syndrome will look like. Yes, how somebody that has a Marfan syndrome will look like, you know. So Marfan's habitus just refers to the characteristic physical appearance of somebody that has a Marfan syndrome, which is a condition that affects what? The connective tissues. So your connective tissues, all of a sudden, they are so elastic. Do you understand? So key features of the Marfan's habitus is what? The person is tall, and the hands and the legs are too long for a normal person. Okay? So Arachnodactyly, so they have their fingers too long and very smooth, elastic, you know. So arm span is greater than the height. Okay, that's what is known as a positive Walker-Murduch sign. Okay, so arm to height ratio. Okay, arm to height ratio is known as the Walker-Murduch sign. So Pectus deformity. So on the chest you have all this Pectus excavatum. So the chest is sunken inside because it's too flexible, you know. So also sometimes Pectus carinatum depends. Okay, it could be sunken or protruded. I have scoliosis and kyphosis. The joint is hypermobile. Have the high arched palate and dental crowdings. You know, narrow face, malar hypoplasia, down slanting palpebral features. You know. So clinical importance is these skeletal features are part of the joint criteria which is used to diagnose Marfan syndrome. And once you can be able to recognize it just by observing the patient, you already made your diagnosis. Okay, so that's it for the Marfan habitus, or known as what? The Marfanoid habitus. Okay, so that's what we got.